gynecologist at South Shore Women's and Children's Hospital. Today we're about to do a few surgeries. First on my list this morning is a procedure called laparoscopic myomectomy, which is removing fibroid but not using the traditional surgery, doing keyhole. So one tiny hole here and two other holes here. And that's how we remove the fibroid. We're doing it because of fertility reasons, and it might be a bit complicated because of our previous history of surgeries. So we hope that it will be quite straightforward, but we've done this many times and we hope that there won't be any problem. One of the advantages of laparoscopy is that people recover a lot quicker and they can go home earlier and return back to work quicker. And also the complications in terms of bleeding, fertility issues in the future is much lesser. It's a skill that's evolving in Nigeria. It's not available in most of the places in Nigeria, but it's something we do quite frequently, and I think a lot of my colleagues in Nigeria are catching up with that as well. But we've been doing this for a long time, so we have a major safety data from it. It's involved us using a lot of advanced technology like cameras, instruments that dissolve or cut fibroid into pieces so that we can remove it. But I sincerely hope that this will be quite straightforward. finished the surgery. The surgery went well. So there was a fibroid that was removed, and other things were done as well. So one of the beauty of laparoscopy is that the risk of bleeding is minimal. I mean, to be honest, the blood loss during that surgery is about 100 ml, which is almost less than, I think if you remember a can of Coke is 300 mils, and 100 mils is 1/3 of that. That's the beauty of that surgery. It's a very highly skilled procedure, and that's why not a lot of people do it around here. A lot of Nigerians actually travel out to do it, for different reasons. Probably because of awareness, they don't know whether we do it. But also, I'm sure people understand that there's still a bit of reservations by Nigerians to Nigerian hospital. Having said that, we do this surgery a lot, and we do it on Nigerians, and we actually do it on people that fly into Nigeria from other countries, Canada, the United States, England, and African countries to do this procedure. The other advantage is that she can go home a lot quicker. She can start work within like a week. She can go back to work and start work, and if she wants to get pregnant in the future, it's usually not very complicated to do so. Now, compared to traditional surgery, which is the open myomectomy, that takes about 4 weeks to 6 weeks to recover from it. So that's the advantage of minimally invasive surgery, which is the one this morning is laparoscopy. Actually, she had 2 procedures. We removed the fibroid and we looked inside the womb with a camera as well, just to make sure that there's nothing. This is a lady that we've treated in the past, and with good results. She had a baby after that. So in summary, South Shore Women's Hospital, we pride ourselves in very good outcomes. We also understand safety in performing procedures. Our doctors we ensure that our doctors are competent enough to do whatever procedure they want to do. We have something called clinical governance that checks what we do, how we do it, and make sure that all our equipment are up to standard. When a patient wants to have a surgery with us, they ask, which day am I doing it? We usually say we can't give you a date until we have certify you fit for surgery. So we run a couple of tests. When we've done that, then we certify them. After we've done that, then we'll have a meeting where all the departments in the hospital will meet, and then we'll go through the procedure and then go through what exactly is needed for the procedure to make sure that we don't find on the day of the surgery or that we don't have this, we don't have that. So that is done a day or 2 before the surgery, just to ensure that we don't get any surprises. On the morning of the surgery as well, we'll go through this again. We make sure that our light source is fine. Is there NEPA? Is there a generator? Everything. We check it before we even start the surgery. And that's been our culture. That's what we pride ourselves in. I think safety first all the time. Thank you.